So what is clinical herbalism? People often use the words lightly and without really fully understanding what clinical herbalism is. So clinical herbalism is, I've been a clinical herbalist for about 18 years. And clinical herbalism is about really cultivating your own self-understanding and self-awareness to get to really understand how you want to be present in a space while you're working with clients. Clinical herbalism is number one, that developing yourself, right? Developing your own inner consciousness and awareness, your inner strengths, your inner qualities, your inner uniqueness. And I would really go with that word uniqueness into clinical herbalism. It is exactly that. It is professional working one-on-one with a customer or client and understanding the journey, the unique journey of that client as they come with their presentation of a health issue. And through that journey, your role as a clinical herbalist is to ask the questions, explore together their journey. Where did they get the dis-ease? Where did the unwellness begin? How is the unwellness presenting itself right now? And sometimes we need another person to help us to hear and see parts of ourselves. And that's the power of being a healer or being a clinician, is to have those eyes. But you need to have developed your own self-awareness so that you're able to be more present in that clinical setting and see and hear for the client. So clinical herbalism is really understanding, again, that clinical interaction of process, which is very individual, intimate, and unique. And once you have worked on that journey with a client, you're able to make an assessment, which is clinical as well. And these assessments come in the form of pulse reading, tongue reading, they could be iridiology, iris reading. It could be many kinds of readings, and including intuitive reading. Some people are more exercised at intuitive care or intuitive knowledge than others, and that's fine. You can use your intuition as well. And so with those assessments, particularly those that have been used by our indigenous relatives for hundreds and thousands of years, like the pulse and tongue reading, we make our clinical assessments and create protocols to support our person, our client on their journey. And so that protocol is your clinical, if you will, recommendation. And it involves your assessment of what foods they need, especially what plant medicines that they need. And these plant medicines can go in different categories. So it could be a herbal tea, a tincture, it could be a powder that you could make with milk. It could be different things, different modalities, but you've got to decide from your clinical assessment which modality would work, and that's unique again to the client. The herbal recommendations could be also a bath. It could be more of a spiritual connection. It doesn't have to be something that they take within. It could be an incense. It could be a smoke bath, right? It could be any of those. But as long as you, as a clinician, have created that relationship because of the journey, to understand which plant medicines would be specific, like a needle point, into that person's life to bring them the wellness that they have come to you for. So, being a clinical herbalist is not an instantaneous learning. It's a process of self-development to bring awareness to yourself to be able to be present with client, and for client to trust you, to take them and to go with them on their journey, and to understand the points of their lives of unwellness. And your assessment will inform you of which plant medicines will be the remedies of those unwellness places to bring them the wellness they deserve.